Hi, Julie,
Good
and
morning. Hello.
everybody. Excuse me.
All right, I'm trying to get somebody the Zoom link.
I got it.
It's Tim, you found it. It was you.
I just had to re-register and it came up. Sorry.
Got it, no problem. Save my eyes because I was doing the for everything. Good morning, everyone. Great to see you. Happy New Year. All right. Did everyone see that slide? Yeah, great. Thank you. Um, all right. Well, here we are. Good to see everyone. Um, Thanks for joining the partnership convening here on early 2025. Hopefully, everyone's had a nice and got some time to relax and enjoy the April-like weather that we had for a few days. That is ending as I speak. I think we're gonna have a little change over here. It's good to be back together this year. I have to when we were at the New Hampshire Behavioral Health Summit at the beginning of December, it was so great to just be there with hundreds of people and a whole bunch of new faces and people introducing other people. And, I've had a wonderful fall of people reaching out, new, new folks in the prevention world here in New Hampshire, getting to know all the different resources and all the, different programming that's happening around the state. I got to do the SAPS training, which is that SPIF application for prevention success training, where a lot of new prevention professionals come together to get that foundational training. And there were so many new faces and doing such great work. So we were excited to kick off this new year to get day to having like folks come together and just share, all right, and just so we could see faces, see names. I know there's some new ones on the call today, and be able to just talk about and share our new resources and initiatives. So thanks for being here for that today. We do meet typically every other month because that's really what the partnership is about is, believing that if we all have the information and the skills to help make ourselves and support healthy decisions, that we're going to have a better New Hampshire with less issues with substance use and positive mental health. So that's just the agenda today. Is I just wanted to welcome you all, wish you a happy new year. I think we'll kick off and start with a little, if that's okay, and Kate and Kate, both. Yeah, where's your partner? Who's with you today? I can't remember. Kate Frey.
Kate Fry. You're
Sorry,
referring to me?
sorry.
Yeah, no, no. And who's Kate? Is there another
Oh
Kate?
no, you just
Oh,
introduced me on
yes.
email today.
Yes. Let me make sure she's here. Sarah Kane is, there
There.
she is. She just waved as I said that. Sarah
Okay.
Kane is our new community engagement coordinator for alcohol and other drugs regulation, and also public health. And Sarah, I'll let you just introduce yourself and say a few words.
Yeah, of course. Hi, everyone. I'm Sarah. I'm super glad to be here. I started about 3 weeks ago, so I'm very new to everything. But obviously, everyone at New Futures is great, and I'm really looking forward to connecting with all of you, specifically learning from you guys. And yeah, connecting one-on-one would be great as well. So yeah, I'm here to learn, and I'm excited to be here.
Sarah's great. She has jumped right in. So please take her word on it and, reach out to her. Just have coffee if you like. And she's going to, I think, do a great job here. Okay. So Happy New Year, everybody. Um, I just lost where everybody is. Let's see. Oh, there you are. Too many windows open. Good to see everybody. So just kind of high level, backing up that we were walking into the first year of the biennium. We had elections, if anyone was sleeping under a rock. So we have a brand new legislature. The that will officially kick off, I believe, the 8th with the inauguration and um, legislators coming to Concord. And I think they were sworn in already, but things will really pick up after that. The most important thing to keep in mind with the first year of the biennium is that it is a budget year. And so a lot of the work we do at New Futures really focuses around the budget and what priorities need to be funded in the budget. In order, there are programs and services, but if they don't have the funding they need, then they can't do the good work that they need to do. We're walking into a budget with likely a deficit. We are seeing probably a lot less federal funding with some ARPA and other federal funding sources drying up. We are starting to see a reduction in revenue. We will see that with the interest and dividends tax. So this year will be very different than the past couple of years for the budget, that we don't have a lot of extra revenue that we can spend. In terms of budget priorities, the alcohol fund, the alcohol abuse treatment and prevention fund, that's one of our top priorities. We are the lead organization on advocacy. And so we are starting advocacy for that already. Sarah can drop in some links, but you can sign up for action alerts if you don't get them already, and updates on the alcohol fund in particular. So we are looking to fully fund the alcohol fund. That was done for the first time 2 years ago after having that law on the books for 20 years. So we are hoping to see fully funding, which is about $10.7 million. Other priorities around issues that you care about, we'll be watching very closely. The children's behavioral health system of care, making sure that there is appropriate funding within the budget to support a robust system of care for kids, non-residential as well as residential care. We are looking at funding 988. This is a year that the state has to look at coming up with their share of state funds to keep that going. And a lot of issues around children's behavioral health. I will say, in an area that crosses both of our work, there is another bill this year on non-academic surveys. We haven't seen the language yet, but we can assume that it has something to do with restricting YRBS surveys. So that is something we'll be watching. In other areas of substance misuse regulation, so we'll see a lot of bills around cannabis again this year, many having to do with the therapeutic cannabis program, but there are 2 or 3 that look to legalize and or commercialize cannabis. I think that conversation will be less robust this year just because the administration, I think, it doesn't support it. But we have seen bills pass the House. They could pass the Senate. I just don't know what will happen after that. But I don't think we are as close to passing something as we were last year. There has been a lot of interesting things within the alcohol space that I'm watching very closely. One of the issues is around privatization. There's been kind of a discussion with some members of Finance Committee that we should privatize our alcohol system. As many of you know, we have a state-controlled alcohol system. As far as public health goes, that is the way to go, that the state regulates alcohol sales as opposed to industry owning licenses. So that is something we'll weigh on. I don't think it'll have a lot of legs, but that is something we'll weigh in on. Another interesting bill that I just know of because other states are really wrestling with it is social districts. That is when whole blocks or parts of the town are kind of almost like a block party. And then people are able to kind of go out and about with alcohol, open container, while it's probably a lot of fun, a great way for, different cultures and different communities to participate. There are a lot of issues that come with that, as far as regulation of that, as far as links to crime and sexual assault and things like that when there's more access to alcohol. A lot of states right now are wrestling with that. So it'll be interesting to see what that conversation is like in New Hampshire. And then just different licensing opportunities too that we'll keep an eye on. So those are the big ticket items. Again, I encourage you all to sign up for action alerts, and especially around the budget. And I'm happy to take any questions too.
Thank you. Yeah, questions for Kate? I have one just for some
Yeah.
of the newer folks maybe in the room. What, taking act, so we get the legislative updates, and I don't know, Sarah just put the link in the chat, so that's great. And then, if advocacy is new for folks, what other opportunities, learning opportunities does New Futures have to help support people taking some action on these important issues?
Yeah, so I would say definitely sign up for or go to our website. We will have some advocacy opportunities this year. We'll have some general advocacy trainings. Also, really exciting this session is every Friday we will have a lunch and learn on different topics and ways that you can advocate. Um, and, we make it as easy as possible when we send out the action alert. People can sign in to the hearings. They can do an op-ed or LTE. They can attend if they like. So there's a lot of different opportunities, and those sessions can walk you through that. Sarah, did you want to add anything here?
Yeah, I also want to add that if anyone feels, anxious or a little bit scared to advocate, definitely come and talk to me or any of the community engagement coordinators. It's really, really important that you do so, especially if you are, inspired and if you are nervous about where to start. Yeah, feel free to contact me, and we can always have a quick chat or meeting about specifically what you could do, because every individual, has special talents and special exciting ways of connecting with people. So we really want to utilize that and just get everyone involved.
Thanks, Sarah. And I see Monica's hand is up.
Yeah, I have a question. I saw somewhere recently, I think it was on social media, that there was a New Futures, or New Futures had facilitated an advocacy summit for youth in a community. And that's something that we would be interested in. We have a very active youth group,
Mhm.
and we typically hold an annual summit for our middle and high school students in our region, which is around Sauhegan Valley. So I'd like to learn more about that for our high school youth.
Yeah, so Jess Wojensky, our training director, she's done a lot of expansion work in the youth space, which has been really great to see. She's been working with a lot of different high schools, sometimes middle school, on training. She also tries to partner with partnerships like yourself, Monica, prevention coalitions. So I think reaching out to Jess Wojensky would be your best bet. We can also make sure she reaches out to you. On our website too, we do have where it says request a training up at the very top. You can fill that out, even if it's not like 100% solid. And then that will get the conversation going with Jess about what you're thinking about, what time of year would work, things like that. But she's done some great work, especially around all the LGBTQ anti-bills that we were seeing last year. We were having a lot of requests for trainings.
Okay, awesome. Thank you.
Yeah, they did a training with a Governor's Youth Advisory Council last year, and it was fantastic. I highly recommend it.
Great. Thank you. And
Jillian. Thank you,
Jillian
Jillian, wherever you are.
just put a number
Sure
of
thing.
advocacy trainings that are coming up in the chat as well. So thank you. And we'll capture all of this and send it out in a summary after the meeting as well. Any other questions for Kate and Sarah?
I have a question, Julie. Kate, do you remember last year there was some legislation introduced around limiting social emotional learning and
Yeah.
talking with youth? Do you see that that will be resurrected at all this year? Have you heard anything?
So that specific bill around social and emotional learning, I would really highly doubt anyone would. I shouldn't say that. I would hope that bill will not come forward this year because it was really a slam dunk with getting that bill killed. Jillian's on the call too. She was very involved in that with her daughter. So that specific bill, I would be surprised to see that come back. But I have seen things come back before that I have said that about. I do think we do need to watch that general theme as we look around a lot of bills that will maybe impact YRBS or how we are able to access that information. So hopefully not that specific bill, but I think with the climate, we do need to be very cognizant of bills that may try to restrict certain kind of outreach and opportunities for kids.
Thanks.
And sort of similar, you mentioned the non-academic survey one coming up again, and I did want to just see if Candace wanted to chime in on some of the newer resources that are available around increasing understanding and awareness about the YRBS, and then some even social media toolkit around that. So Candace, I hope I'm not putting you two on the spot. Would that be okay?
Yeah. So
Thank you.
I'm just gonna pop the link in the chat. So it's newhampshiretech.org. And they are technical providers for the state. Also, hi, I'm Candace, the prevention administrator for the state of New Hampshire. For those who don't know me, new last name. I popped it in the chat so you can take a look. But if you go to the top and you click on the YRBS link, there's a ton of great videos in there. One is just a general overview of what the YRBS is. It's cartoons, so you can use that with parents, school boards, administrators, teachers, etc. And then there's also some videos in there that were created by Growth Partners across New Hampshire there's a youth focused one which is real life New Hampshire youth talking about their experience with the YRBS. And then there's also different administrators, police chiefs, hospital administrators, all kinds of different community members in the other video. And that looks at their interaction with the YRBS and how they use the data and how it can fund different programs in their communities. So there's toolkits available, there's social media clips that are available as well. And then there's also a how-to on there that Growth Partners created for us. So if you're not super social media savvy, you can just review that, and it walks you through how to put all of the videos on your social media and how to embed them into different whatever you need. So these are really great resources because we found that videos speak volumes, and you're able to hear from multiple different members of the community in New Hampshire rather than just certain folks. So take a look at that. And then we're also working on, which I think Liz will talk a little bit more about in a little while, but we're working on some toolkits specific for different populations within New Hampshire. This has been a very slow process. You may have heard me talk about this in the past, but one that we're going to have coming up is driven by Youth for Youth. So they're actually developing it. They're piloting it with their schools shortly, but it's going to be a game. So we're going to kind of make it a little bit competitive. The RPHNs are getting on board with rolling it out, but the kids are developing a Jeopardy game about what the YRBS is, why you take it, what the data goes for, why it's important. And then Liz and her kiddos with her youth group are developing with her youth some announcements that will go out. So like it's written by Youth for Youth, so speaking their language. to talk about the importance of the YRBS. So all of that will be available on nhtac.org, but most of that is available currently, but the other toolkits will be coming. Fingers crossed later in the year.
Awesome. And great to use some of these things leading up to schools, implementing this spring, right? In 2025. A lot of schools are signed up to do the YRBS. And families can opt out, and so this could be helpful for folks to just increase knowledge and awareness at school board meetings with your own staff, like at schools, other faculty. I hear a lot of people with some hesitancy and skepticism about it. So it's good to have the actual information.
One thing that I just wanted to add really quick while I have all of you here is a lot of schools in New Hampshire are actually opting to do the YRBS in January, which they've always been allowed to do it in January, but we haven't always had a lot of schools take that month. But this year there are quite a few, so maybe checking in with your schools ahead of time earlier than you normally would. I would suggest doing that because you may find that they're getting ready to take it shortly.
Anything else for Kate? New futures? All right. Well, thank you very much. And I hope people reach out and get to know Sarah even more. That'll be great. So full disclosure, I don't really have a plan for this. I know there are a lot of people on the call that have things to share, and I'm excited about that. And I didn't make an alphabetical list or anything like that. So if you are ready, you can raise your hand and we'll do it that way. I can call on people that I know are ready to, or are going to share something. But I do ask that you introduce yourself and the organization that you're at before that was pretty natural. And then others can also just maybe change your names in your Zoom box to add your organization as well. So, Melissa, was this you're ready to start?
Sure, it was my morning calisthenics. Yes. Good morning, everyone. Melissa Lee. I work with UNH Cooperative Extension out of our Merrimack County office. For those of you who are not familiar with Extension, we are the outreach and engagement arm of the university system. And really, our task is to bring research-based education and technical assistance and resources out to communities in New Hampshire. So I am a certified prevention specialist and work on our health and well-being team. Really I'll say we're fairly small, but a team that's spread across New Hampshire, and we do work statewide. But I wanted to share just a few of the resources that you may or may not be familiar with. Always a good reminder of what Extension has currently, and/or I will say we are always looking to partner. So I'll put that out there. But we have a website that is full of valuable information and resources. So first, I will eventually drop this in the chat, but it's just extension.unh.edu. And if you visit our website, you'll see we have a variety of programming areas across the top, but if you click on health and well-being, it lists our programming initiatives. So today I wanted to just share a little bit with you about some things, including mental health first aid. I'm sure many of you have heard of that course in the program. We have been given the opportunity to receive funding from SAMHSA and have a contract through the DOE to kind of be a bit of a backbone and resource for mental health first aid education in New Hampshire. We offer kind of ongoing events that folks can sign up for through our website, virtual programs that are free to community members. So adult mental health first aid, youth mental health first aid. And we do have a focus right now on a new version of the program, which is focusing on mental health for older adults, recognizing how to identify and help older adults who may be experiencing changes, loneliness, isolation, and how we can help, how we can be that first line first aider for folks, connecting them to resources and hopefully helping people be well. We have dollars to pay for folks to become instructors. So if that's of interest to you, if you want to become an instructor and offer this in your community or with populations that you work with, please reach out. I'll drop my email in the chat as well. So that's a kind of an ongoing great program and resource that we have. We also have a resource currently called the Community First Responder Program. And it's all about educating the public on how to respond to opioid overdoses and use naloxone. So we are in partnership with the University of Rhode Island and have funding at least through this fall of September to be educating folks in our communities and distributing by mail free naloxone. So I'll also pop that in the chat in a moment, but we've been doing this for about 1.5 to 2 years now. We have a resource on our website. Anybody can go in, click on it. It takes about 10 minutes to learn about opioid overdose response, and then you can fill out a little survey at the end and you get free naloxone in the mail within like 3 days. So far we have distributed 734 addresses in New Hampshire. So folks can take the education and not put in to receive the naloxone, but we know that for sure 734 households have received naloxone. You can also request fentanyl and xylazine testing strips through that as well. If anybody's interested in the data of where this stuff is going, reach out to me because I have that too. Happy to collaborate and share. I love working with folks on strategies to get this information out into your communities. It really is I think, a great counterpart to a lot of the other naloxone education opportunities that we have going on. We have a lot of prevention programs and self-management programs for folks with chronic pain and chronic illnesses. Those resources are there. Yeah. Julie, was there something else I was going to hit on?
Well, maybe just a little bit more of the chronic pain. Like, what is that? What are those self-management classes?
Well, yeah. So we work with Southern New Hampshire Area Health Education Center, great resource, to provide what are called self-management programs. And in particular, Julie's talking about a chronic pain self-management program. So we started doing this a few years ago. We got some endorsement and funding from SAMHSA, who recognized that this program is a great strategy to help prevent medication misuse. It doesn't dispel in any way the importance of medication in managing chronic pain, but talks about how to manage medications and what are some other strategies that folks can use to manage chronic pain, because 19% of adults are impacted by chronic pain. And when we think about the downstream effects of that, it's significant, people not being able to work or do things with their family or in their community and just not thriving. So this is a really great resource to help folks get connected to a community and learn some skills and opportunities to be well. So we offer those on an ongoing basis. Again, they're on our website. Love to bring it to your community if you'd like something in person. So again, I invite you to reach out. We'd love to partner and help reach people in New Hampshire. So thank you. I'll drop a couple things in the chat.
I think I took care of all of them for you except for your email address.
Oh, okay. Thank you.
And I don't know if I can do that for everyone because I know those websites. Questions for Melissa? I just want to put a plug in for mental health first aid and becoming an instructor. I think it was one of in my adult life, probably the most meaningful educational opportunity was when I took it as a participant and then immediately signed up to become an instructor. because it's just, I think, one of the most, when we talk, we're like seeing, it's really looking at before crisis. It's really giving and how to handle when the crisis, when you're really suspecting that somebody is in crisis. I think so many of us can notice that and feel, I hear this all the time. I don't want to ask because I don't know what to do if the answer is yes. Right. And it really empowers folks to ask the questions. How are you doing? Are you thinking about, killing yourself? Like, as scary as that is to say, it empowers you to be able to do that and gives you the resources to connect them with what they need afterwards. And I think if we all felt more comfortable, many, all of us in our communities felt more comfortable doing that, we'd be in a better place. So look into it if you're not familiar with it. Monica, did you unmute?
I did. I was going to just kind of second what you were saying about the mental health first aid. So Monica Gallant, Director of Prevention Services at the Boys and Girls Club of Sauhegan Valley, which is in Milford, New Hampshire, and also the Director of the Drug-Free Communities Coalition Community Action for Safe Teens, which is also at the Boys and Girls Club. So we have several youth mental health first aid trainers, actually teen mental health first aid trainers here at the club. And we are some of our staff is also going to be trained in the youth mental health first aid. And we've been offering it to our community recovery centers, our schools, and our boys and girls clubs, and they have found it so valuable. Even people that are, professionals, like counselors, school counselors, they find it really helpful. And our paraprofessionals are, they're frontline service providers, so it's really a benefit to be able to provide that training to your community. So I would highly encourage anybody to take advantage. And through the UNH program, it's free to attend the training. So it's a little bit of a time commitment, but it's well worth it. The other thing that I'll share, and Julie, you'll be happy that I'll share about this, is our Children's Resiliency Retreat program. It is a mentoring program for kids in grades 1 through 12 who have been impacted by a loved one's substance use disorder. So it's specific for kids. It's not intended for kids that are using substances. It's a recovery support program for kids that are impacted by a loved one's substance use disorder. So we have recently completed a toolkit with JSI and are happy to introduce it to other communities as well. We are going, it's identified as a promising practice right now through the Service to Science program, and we're going in front of the panel in March with the hopes of becoming evidence-based. So we've been running the program since January of 2018, and we currently have 25 youth participating, and some of them, I'm going to say, probably 7 or 8 have been with us since the start. The kids really enjoy the supportive network and learning that they're not alone with their, whatever their issues are. So, if anybody has any questions on that, thanks, Julie, for putting the link in the chat. You can just give me a call or send me an email, and we do offer it to our community as a free program. Thank you.
Yeah, I just saw Trisha and then Liz.
Hi, Trisha Brannon, Executive Director of Youthful New Hampshire. Monica, I had a question for you on the Teen Mental Health First Aid. That is the program where teens are trained in mental health first aid, and then they're able to help support peers. Is that correct?
That is correct. It's a program for teens.
And
Yep.
So do you have students within your schools that are providing that mental health first aid support for peers?
Yes. Yep. And we've actually been invited into one of our school's health classes this year, to our advanced health class, to
Okay.
provide that training to that full class of students.
And is that at the high school
Yep.
level?
Yep. It's at Milford High School.
Okay.
Yeah, it's a high school level curriculum.
Yeah.
So it was originally 10 through 12, and they've just changed it to 9 through 12. So
Does is your catchment area outside of do you have other high schools within your
we
area?
do. We're Sauhegan Valley, so it's Hollis, Brookline, Milford, Sauhegan, Wilton, Lineborough, and High Mowing, which
Okay.
is in Wilton.
Do you foresee that that program will be able to get into those other high schools?
Hopefully, eventually, I do expect that. I mean, we've done it at High Mowing with their health class a couple of years ago. So we trained 40 students there. We have worked with Milford High School and have trained about a dozen students in Milford. Now we're going into their health class or the advanced health class. Yeah, and so we actually just hosted a training for teen mental health first aid or first aid facilitators, and we had several people from our local schools attend the training, so they will be, excuse me, doing the training for their students in their schools.
That's great.
Yes, yeah,
Thank you. That's
you're
excellent.
welcome. One other thing that I want to share along the lines of mental health is our youth group has been working on a project, a mental health awareness campaign for the past year, and they raised enough money to put together 3,000 comfort cases, which they are delivering to high school students. So far, they have gone to about um, right around 300 students, and these comfort cases, they've gone to high school students so far, and they include fidgets, an inspirational journal, some affirmation statements, um, sensory stickers, things like that. And they have been so well received with our schools. When the youth first presented to the teachers at our Milford High School, and the teachers were really excited to receive them themselves. And then they've allowed us to come in and present to the students and give them to the students as well. So big push on mental health awareness. So.
Thank you for sharing that. Liz, you had your hand up.
Yes, I would love to co-present uh, the Getting to Why initiative with Kate Merrigan. We did create a little bit of a presentation. Could I actually share our screen?
Yes, I believe you should have.
Fabulous.
And the slides have all of the links in them. So Julie, I know you wouldn't necessarily have these links to share from the Up for Learning website. They're in here, so you can sit back from the awesome work
Okay.
of sharing links.
Awesome.
I can actually share the presentation with you afterwards as well.
Great, thanks.
All right. So, good morning, everyone. My name is Liz Brochu, and I'm actually from Communities for Alcohol and Drug-Free Youth. And I have the great honor of being the project director for the Getting to Why New Hampshire. And I'd like to thank Julie for the opportunity to present this morning. So we're super excited to roll this information out. I would like to introduce Kate Merrigan. She is the program director from Up for Learning, and she's going to speak a little bit about Up for Learning and the great work that they do, and then give an overview of the Getting to Why program. And then I'm going to provide some more details of the New Hampshire kickoff event on January 23rd. So I'm going to pass it over to Kate to talk a little bit more about Getting to Why.
Yeah, thanks, Liz. I'm so excited to chat with you all. I was lurking in the background of your last few partnership meetings, and now I'm saying hello. So, Liz introduced me. I'm with Up for Learning. I'll tell you more about us for in a second. Liz, can you advance this slide for me, please? Thank you. I don't want to give a ton of info about Up for Learning because we really want to focus on getting to why and the New Hampshire rollout and statewide replication, but I want to give you some context in which getting to why exists. So I'm with Up for Learning. We're Vermont based, but we do work nationwide as a nonprofit. But we started in Vermont, so a lot of our work is based and grounded and has been developed there. Our mission is to empower youth and adults to reimagine and transform education together. So um, as such, youth adult partnership is part of everything that we do and is really what our work is most grounded in. And I won't spend too much time on this, but we really focus a lot on all of our projects, all of our work with schools and community members to employ data to drive change. Liz, can you go to the next slide? Actually, thank you. So we use youth participatory action research as a mechanism to create change. So we use youth adult partnership to bring people together to explore data, either data that already exists about their schools or communities or data that they gather as a team through their own design process. We analyze that data and design action plans to create positive change and positive outcomes for young people. That's very quick info about Up for Learning. We do many things, but what we're focusing on now is Getting to Why, one of our programs that has most quickly spread beyond Vermont and that we're going to be supporting a statewide launch of in New Hampshire. So Getting to Why, first, I should say, what's that Y part in the first slide? It's just the letter Y, which I think sometimes can look confusing. It stands for a few things. One is youth. We're getting YRBS results back to the youth who gave us that data in the first place. So we're getting it to youth. And also getting to why, like WHY. We're getting to the meaning of that data and behind that data and making meaning out of it. So we train teams of youth and adults, middle school and high school teams to work together to analyze their local YRBS data, present it to others, get input on it, work on understanding it in conversation with their community, and then use those findings to make change in their community. I won't go into all the details I have on each slide because of time, but these are the demonstrated outcomes of Getting to Why that we've learned since we launched the program in 2008. We've had over 100 teams in the states listed here. Indiana's new this year. I'm going to be traveling out to Indiana in February to train some teams there. We've had teams in New Hampshire. You'll hear more about that from Liz. And we're all across the state of Vermont because we started there and we've spent the most energy growing there. We've been designated a best practice by AmChip, and we're in their database, the links in the slides that I shared earlier. And I also see that I made a weird formatting choice right before we logged on. We're also an evidence-based practice with the Vermont Department of Health. So we've got that status there, so that designation. Can we move forward to the next slide, please, Liz? Thank you. I've got two ways of looking at this. I want to give you the quick at a glance version. And then we're going to go to the next slide that goes into more depth. So when I talk about Getting to Why, what is it exactly? What are we doing in Getting to Why? So let's go to the next one. I'll just summarize it, but you'll have the more detailed version of it. So a team of middle school students or high school students with adult advisors come together as a leadership team in their school. They attend a training, often in the fall, but they can be in the winter. And whenever they start, they run through the end of the school year generally. We train them in how to be a leadership team for Getting to Why. We practice together and learn the activities that they'll run with their own community members at their school. That's the first step. They do the training. They learn how to interpret the YRBS. They learn how to analyze data. Then they hold their own data analysis retreat with their school and try to invite a representative team of young people from their school and some adults as well, ideally, to do a deep dive into their data, spend a full day looking at their local YRBS data. They draw strengths and concerns about their community from that data, and then they hold a community dialogue event sometime later, in which they involve lots of folks from the community, right? Ideally, lots of you folks, and they have a broader conversation about their findings. They present them, they get more input, and they start to think about what solutions might there be to one or two of our biggest concerns that we've identified. They design an action plan and they make it happen and then celebrate that. And then many teams keep working on the same maybe top concern and top action area they identified into the next school year. They might pick something new next year. They might keep working on a project for multiple years. Let's go to the next slide, and I'll kind of wrap this piece up and turn it over to Liz in a moment. So in Vermont, again, we've been running the program there the longest. We have a great partnership with our Department of Health, and I think we're going to be seeing something very similar in New Hampshire for you all, which I'm so excited about. So the Vermont Department of Health provides a lot of support, including funding, that makes getting to Y training available for teams in Vermont across the state for little to no cost. We sometimes have had 2 statewide trainings in the fall, one for middle school teams, one for high school, where we bring a ton of teams together. Sometimes we do clustered regional trainings where we might have a training in like southwestern Vermont and have 3 teams come. We change it year to year depending on what the needs are. We support the teams through a monthly networking meeting for advisors at which we have professional learning opportunities, treat it as a community of practice to problem solve together. We share a monthly newsletter with resources and ideas and sometimes calls to action from us up as the staff supporting this. We provide technical assistance for teams and advisors as needed. And then at the end of the year, we publish a newsletter to celebrate all of our teams across the states that we're working in with their stories, which you'll see an example of in Liz's slides in a moment. So again, I shared the link to these slides. There's several things embedded in here. Our Getting to Why page on Up for Learning's website is very detailed and has a great video too that walks you through sort of what a team's work can look like during a year and links you also to the newsletter where you can see what teams have done. We're very lucky to be working with Liz and with Katie to make this happen in New Hampshire. I'm so excited. Liz has been a very involved and passionate partner and is doing a big lift to make Getting to Why available across the state. So I'm super excited. She's going to tell you more about that.
Awesome. Thank you so much, Kate. It's been an absolute pleasure so far, and it's going to be an awesome year. 2025 is going to be an amazing year working with Up for Learning. And Kate's going to be with the New Hampshire Getting to Why the entire journey. So we're super excited to have both her and Lindsay, who is the executive director of Up for Learning as well. I'd also like to extend our appreciation to Jill Burke, the Bureau Chief of BDAS at the DHHS for her leadership in bringing this youth empowerment prevention program to New Hampshire for a statewide implementation. So we couldn't do it without her, and she's absolutely wonderful. As most of you know, Katie is the facilitating organization for the Getting to Why New Hampshire. And I mentioned before, I will be the project director for our implementation team. And I do want to just preface that our whole implementation team is all of us. So it's the New Hampshire prevention professionals, the SMPCs, the DFCs, the SAPs, and all the in-school partners. So we have to do this together and to make this a success. So I'm super excited about that. And I will be working very hands-on with all the SMPC and DFCs and in school. And Julie's absolutely wonderful. And Ryan, we're going to be working with the SAPs. Thank you for letting us coming in and working and meeting the SAPs. We're excited to begin that relationship. My email is up on the screen right now if you have any questions, but our direct contacts for the schools will be the SMPCs and DFCs. A super brief history of Getting to Why in New Hampshire. We've actually seen this before. So in 2019, pre-COVID, BDAS brought up for Learning to the community of practice for prevention professionals statewide, and that was at the New Hampshire Fire Academy in Concord. Everyone was excited about this. I still remember the excitement in the room about this initiative. Of course, though, 2020 happened and that the COVID, once that happened, it was laid on the table. But it was brought back to top of mind in November 9th, 2021, New Hampshire had its very first Getting to Why student training in central New Hampshire at the Common Man Inn in Plymouth. Newfound Regional High School and Plymouth Regional High School students participated and really analyzed their YRBS data, and the program took off. I'm going to do a shout out to Darren Smith. She's the Substance Misuse Prevention Coordinator for Greater Sullivan's County. She attended our regional training and immediately brought it for the Up for Learning in to do the training for Kearsarge Regional High Schools, as well as Kearsarge Middle School. So she's been taking off. It's really been it's been a well-loved program for a while now. Currently, there are 7 schools in one community-based program operating in New Hampshire. Um, and because we have a tight timeline, we really need all hands on deck. So ideally, we would be rolling out Getting to Why earlier in the academic year, so no later than October. However, and I'm super grateful that the Governing Council did approve the contract, but it was approved a little later than anticipated. So we're really trying to get this rolling as fast as possible. So our timeline really is kicking it off and just under 3 weeks. We're going to be having our kickoff conference on January 23rd at the Grapponi Center. We do have an invitation that went out to schools. 177 schools received this invitation to participate in the statewide rollout of the Getting to Why program. We are having people are signing up on the Eventbrite, which is fantastic. We will be dropping the invitation in the chat as well. So please be aware that this is happening. This is a way for people to get more information about what Getting to Why is. Kate is going to be there and doing not only the history and the deep dive into what Getting to Why is, but she, as well as Lindsay, will be doing the training the trainers in that day. So they're going to be running workshops, and those people who want to be trained will be certified trainers of Getting to Why. We are going to be doing some MOUs, so this will be an opportunity for us, the state-run program, to run the program with fidelity, and that is our whole goal, is to bring this bring justice to this amazing program. We are currently in the process of scheduling 6 regional trainings, which will happen statewide, and this is going to be bringing in the youth. So there will be about 8 to 10 to 12 school teams of youth leaders that will be coming into these regional trainings. We are going to be putting them all over the state, and any school can attend any of these trainings. However, we hope that they will be choosing the closest training to their school. So that is going to be happening in February and March. March YRBS is happening, like Candace said earlier. Some schools may be taking their YRBS earlier in January, maybe February. But we're going to be rolling out this YRBS awareness campaign. Candace talked a little bit about the YRBS work group and the youth who are going to be doing this trivia game, which is fabulous. They'll also be talking about this at the conference. So those participating schools will be able to get a jump start on that awareness campaign. We will also be doing an April listening tours. There will be TA ongoing. There will be meetings, monthly meetings for mentors and advisors to meet with myself and Kate and really help the students with their projects and initiatives. We will also be working with Up for Learning and doing a New Hampshire Getting to Why newsletter and our successes and outcomes for our youth. And then we're going to be working with these youth and doing another statewide conference in October. So we really want to kick off the school year as a review on what they learned and what they've been working on in January, February, and March, and get them going and get them excited for the next that next year too of getting to Y. So we're super excited about that. I do want to share the invitation for the conference and training, but first I want to share some pictures of the New Hampshire youth that are already involved in getting to Y. This was the Newfound Regional High School. I just want to spotlight these amazing youth leaders. They were the first real getting to Y youth. I just absolutely love these students. They were so engaged in the getting to Y, and they were the ones that really did the kickoff. I think they were just absolutely wonderful. They testified on the importance of the YRBS. So really bringing that youth voice to the legislation of YRBS is really, really important. So they're fabulous. We also had the multiple region training last year or the year before, and it was the biggest training that Up for Learning said that they've ever had. So that was really great as well. We have Kearsarge High School in North Sutton. Their advisor is Darren Smith. I talked about her earlier. This is a little bit about their initiatives and their strengths. Again, they're going to be talking about what they're going to celebrate their school's YRBS strengths. So that's really something fabulous that Getting to Y does. They celebrate those strengths. They also have those three priorities of concerning data and how they're going to work on that data and what are their initiatives going to be like. So this is their 2021 information. And let's see. So Merrimack Valley High School in Pennacook, they are a team as well. Pinkerton Academy in Derry and Portsmouth High School. And we also have, again, that Kearsarge Middle School is also involved. And just to put a little idea in your head, Up for Learning also has P2C2, and that is focused on middle school. And anybody who is working with middle school or doing the YRBS with middle school, that would be something that you might want to look into. But right now we are focusing on the high school implementation in New Hampshire. So just to talk a little bit about the statewide kickoff conference and training, it's going to be Thursday, January 23rd. We do have a snow date, which would be Thursday, January 30th. So let's hope that we don't get snow, but if we do, then there is a backup. It's going to be in Concord at the Grapponi Center from 8:30 to 3. There'll be a continental breakfast, there'll be a lunch, and again, that's where they're going to be training the facilitators, the trainers of Getting to Y for that sustainability. We also will be hearing from the youth voice. So we're going to be hearing from Kearsarge students. We're going to be hearing from those Merrimack Valley and those youth leaders who really are driving this program. So this is the invitation. Please register yourself if you would like to come learn more about it. If you want to be a trainer, please come. We will also be having resource tables for school administrators for youth to look at. I did send out an invitation yesterday. If you received that, if I did not send something out, please let me know. I would love to have everyone and anyone there to just show how the plethora of resources that New Hampshire actually has. And if they do have mental health is their priority, they already have so many resources at their fingertips statewide. So please give me a shout out, and I will send you that invitation to register. And we're just so excited about this, as you can see. And like I said, we need everybody involved in this, and we are ready to go. So now we can do some Q&A. I see Tim has a question.
Hi, Liz. Yeah,
Hi.
sounds fantastic. I'm really glad to see this gaining some traction here in the state. Timberlane, as you know, has not done the YRBS for many years. We were very active doing it from 2001 through 2011.
Mhm.
We are finally going to be starting again as of 2025. Would In terms of you have to have existing data to get trained in as a trainer for this, or
No.
if we anticipate having data for 2025, we could send somebody to get trained as a trainer.
Yes, absolutely. Send someone to get trained, and then once that 2025 data comes in, then that can be Kate will come back. She'll do those trainings, hopefully in the fall. But I would also send a team of students to one of the regional trainings so they understand what kind of data analysis is happening. There's some schools that will not have their data if there's a small um, sample size. They won't be receiving their data. There has to be some there. I believe it's 60% of participation to receive their data. So if that's the case, that's why raising that awareness in March, and this is why the youth voice is so important. Bring those youth to these trainings, get them excited about their local data. And that way they're going to be asking to take the YRBS to continue this the getting to Y. They're going to be excited to be prevention agents.
Mhm.
So absolutely bring them on.
Thank you, Liz. Kind of on this note, Ryan, do you want to just bring up the middle school YRBS? Speaking of people having this data, I know the state of New Hampshire sponsors and facilitates and pays for the high school YRBS, but not the middle school YRBS. So Ryan was going to just share some resources available for that.
Yeah, and I don't know if someone from the partnership just wants to share. I made like just 2 slides just so it's kind of easier, I guess, to follow. So yeah, this is not in any way affiliated with all the great work we've been talking about, just because sometimes I think people tend to confuse high school, middle school, and think it's kind of the same piece. So this is just like a different plug, a different thing on the side, but it's in the same vein of youth risk behavior surveys. So the Center for Excellence on Addiction offers middle school youth risk behavior survey services for any interested district across the state. So if you are an SAU who wants to do a middle school YRBS, it's not like, there's no like state entity. You would have to seek it out on your own, and we are just one of those services that provides that service. So that's just kind of what that is, because I think a lot of times people think, oh, when is the state one happening? There is no statewide middle school one, as for a few reasons. But what we do is we use the CDC's General Middle School Survey, since there is a nationwide middle school survey the CDC creates alongside the high school one. But what we do is we take that one and we combine it with drug-free community grant coalitions, like core measures that they need to know for their own coalition data. So we take these two and kind of combine it for our own baseline survey. So if someone reached out to us and were interested in doing one, that would be the baseline survey that we start with. So we're able to kind of knock out 2 birds with 1 stone, right? Having the the one that the CDC uses, but also a lot of the folks that, need that data from the DFC, because I know that, uh, the people above them are always knocking on their door, like, where's your data? Where's your data? Right. And this is a great way to be able to do that. Right. So that's what we do. And then there are also additional questions that can be asked and thrown in there if that is a question, right? That a district wants to know, like off the top of their head, if that's really important to them. We've worked with some schools who are very interested on certain things more pointed to their own community, right? So you can add those as well. But so that is that. So if we want to go to the next slide, Julie, I have two. So again, just to remind you, it's not coordinated or funded by the state like the high school one is. So I just want to make that clear. So because a lot of times we might work with an interested party and they're like, well, can we compare our data with other middle schools across the state? And unfortunately, you can't, just because that doesn't exist, right? There is no big statewide sample. So if, let's just say, picking a random New Hampshire town, Salem, New Hampshire had one at their middle school, it would just be for Salem. It wouldn't be in comparison to, everything in their Rockingham County or statewide, unfortunately, right? There could be maybe an agreement made that if you are, let's say you're Salem and you have a good relationship with, I don't know, Wyndham, and they have their middle school, right? And you want to say, hey, why don't we compare our data together, right? You could potentially do that, but there might be some hoops that you have to jump through to do that. That's not so much on our end. That would be on the district's end if they wanted to just kind of do like a regional comparison or what have you. But the baseline questions that are asked are similar to the high school one. So behaviors about unintentional injuries and violence, social emotional well-being, alcohol, tobacco, other drug use, dietary behaviors, physical activity. There are 4 questions in there about sexual health as well. But we kind of tailor it to whatever works for your communities, right? There are some folks who are actually on this call that I'm actually working with already on this, which is really exciting, right? And if you're an SAP funded school, right, you have added benefits being able to do this survey too. So to me, if you're an SAP school, you might as well do it since you have that connection with us at the center. But if you're interested, we're happy to provide these services. I will say, we've got a lot of interest this year, which is excellent, which we're super excited about. But we've had so much interest that we kind of if you want to do it, you kind of need to let us know within the next, I would say no later than this month, to be quite honest. But this is just the plug more so that if, it might be late in the ball game, but if you're thinking about it for next year, please reach out to myself. You can fill out if you go to our website, there's a form you can fill out at the bottom about, just general interest, and we can set up a meeting and kind of go from there about pricing. And we've lowered the price to make it more commensurate to what, we think the services are able to do for communities to try and make it affordable too. So, and as Amy Daniels posted in the chat, couldn't agree more. It's incredibly valuable for high schools to understand what's coming in, right? Like, what are the trends? So if you have a grade that's, let's say a 6th grade is high marijuana usage. Well, if you do that every year, by the time they're in the high school level, you're going to be able to know, we need to watch out for this cohort, right? So, but again, we're very open when working with folks, and and our data team is excellent putting together an awesome report to have. So.
Great. Thank you. We are tight on time, and I know a number of people have things to share. So we're going to kind of boom, boom, boom. Tim Lena has another conference to share, and then I'll have Martha Bradley talk about another conference. Yay! Prevention work.
All right. Again,
and Trisha Brannon as well. I want to have Trisha introduce herself. Go ahead. Sorry, Tim.
Okay. Just quickly, I'm Tim Lena, the Student Assistance Program Coordinator here at Timberlane Regional School District. I'm also direct our Southern Rockingham Coalition for Healthy Youth, SOROC. I know Charlotte's on the call as well. She's our program director. And we are thrilled to announce that we're trying to breathe life back into the Life of an Athlete program, which is an evidence-based program that was put through the Service to Science here in New Hampshire with JSI. We have sent out invitations through the athletic directors to put together teams of students to come to Concord. Pray for no snow on Liz's conference, because it's on January 30th. And it's going to be at the Primex Center in Concord. We have already 30 schools that have responded. We're going to have close to 100 students And we'll be doing my students here from Timberlane are going to do the the student facing training on the Life of an Athlete 101. There will be another breakout session about Be Bold through the One Trusted Adult, another breakout session with New Hampshire Teen Institute. They'll be doing things on confronting behaviors of concern and talking about their summer leadership program. So a number of evidence-based programs will be a part of this student leadership conference, which we're very excited about. And there'll also be an adult track talking about how do you set up student leadership with the Life of an Athlete program. And there'll be another panel with JSI and Center for Excellence, as well as Department of Ed, talking about, again, the evidence-based behind Life of an Athlete, the Summer Leadership Program, and the Be Bold One Trusted Adult curriculum. So we're really excited about it. We're hoping there really seems to be a tremendous interest among the athletic directors. There's been a big turnover in athletic directors since the pandemic. A lot of student leadership programs have kind of died off in schools, so we're excited to try and get things started again. And if we certainly encourage you to reach out to your ADs. There's still a few spots open. If your school hasn't signed up, let me know. We'll be happy to try and get them in.
Great. Thank you very much. Questions for Tim? Maybe we can do them in the chat so we can. All right. Trisha, can I have you introduce yourself? I met Trisha and heard about YouthWell, and she introduced herself in the chat and made a connection about something one of the youth she knows is interested in. But please introduce yourself, and then I'll have Martha and Emily go.
Thank you, Julie. My name is Trisha Brannon. I am the Executive Director of YouthWell New Hampshire. And I'm really grateful to be at this meeting today to meet all of you folks. Some of you I have met, but some of you I haven't. So it's really great to be able to meet you today. YouthWell New Hampshire is a New Hampshire nonprofit that began about a year and a half ago. We are a funding source for youth mental health program services and new initiatives. We started, our founders really wanted to make an impact around mental health. And as we began this journey, we realized, as I believe Liz spoke about, the state of New Hampshire has so many incredible mental health resources available. And sometimes they don't have the funding they need to be able to continue those services, to enhance those services, expand them, and whatnot. So through our education and research, when we started this venture, we decided that the best way we could support our community was through funding. And so that is our focus. Both myself and the founders have background with youth. So that's one of the reasons we directed our efforts to youth mental health, and also obviously because of the youth mental health crisis that we have found ourselves in over the last several years. We also partner with and assist other youth serving organizations beyond funding in any capacity that we're able to. Whether that's volunteering, whether that's serving on a committee, lending a hand at an event, whatever it might be, to help those youth serving organizations with their mental health missions. And the third thing that we focus on is advocacy. We make sure that we stay on top of all of the new policies, legislation in the state of New Hampshire that could be beneficial to youth mental health or detrimental to youth mental health, and then we lend our voices accordingly. This year we had the great fortune to have Morgan Berry become our first youth volunteer, and I would say youth volunteer slash intern. Morgan is very dedicated to being a mental health advocate. She co-founded the mental health club at her high school in Nashua. She is struggling a little bit this year because she is still finding that there's quite a stigma around young people reaching out. That's the experience she's having in her high school. And she's really interested in connecting with other students. I put this information in the chat around the state who are interested in mental health awareness. If they have a mental health group at their high school, she wants to come together with those other students to share ideas, network with each other, and collectively advocate together for the good of youth mental health, to improve and positively impact that. She's really behind mental health education in public schools. That's something she's really interested in advocating for, and she would like to work and speak with other students around the state. Youth Well New Hampshire is willing to be the convening organization to bring those young people together. We also are interested in hoping to partner with New Futures, NAMI New Hampshire, in helping young people learn about advocacy and have advocacy training, etc. We have been able to fund in the last year and a half almost $200,000 worth of programs throughout the state, directly impacting youth mental health. So that has been really exciting for us. Our website has scrolling on the homepage the programs that we have supported thus far, to give you an idea of some of the programs that we have funded. We currently have a fall grant cycle and a spring grant cycle. We just ended our fall grant cycle and have sent out our awards for this 2024 fall. We were able to fully fund 7 programs. So that was really great. We're excited about those programs. Our spring program, we will start accepting applications March 17th through April 14th. And then applicants will be notified by June 2nd. We also have year-round organizations can apply for mini grants up to $500 for anything that might come up throughout the year, for different programs that you would like to provide. We have a couple examples of those mini grants. We supported Dover High School has a mental health reset day. There's a Stepping Stones Pediatric Therapy group who is providing mental health support groups in their pediatric office. And so those are the sorts of things that we've been able to provide funding for. If anybody has any questions or would like to talk further, please reach out to me. I put my email in the chat, along with our link to our website. And again, it's really great to see all of you and meet all of you today.
Awesome. Thank you, Trisha. Thanks so much. Gosh, you have so much. I should have known this was going to be more than an hour and a half. Martha, sorry to have us here at the end. And we do have these wonderful things coming in on the chat. I appreciate that. Jess Morton just put some resources in. Barry introduced himself. Awesome. And go ahead, Martha, you want to unmute? You're still muted though.
I'll keep it quick. We had planned for more of a discussion, but I'll just give you the high notes on a prevention
Sorry.
conference that's being planned for Monday, May 12th. So this spring. Mark your calendar. We did do a save the date, and we'll be opening registrations shortly. We have a website called New Hampshire Prevention Conference, and the conference is really being planned by committed partners. And JSI, whom I work for, is the event planner, along with Emily McMaster, who's on this call. It's currently being funded by the Tobacco Prevention and Cessation Program. So I wanted to give a shout out to Jess Morton for her support with this. And through BDAS, the SAP network as well. We are going to be doing some other fundraising for it as well, looking to other organizations to help support it. So again, it's May 12th, and what we're asking, why I wanted to come and talk to you all today is we're asking for your feedback and ideas, insight on speakers, workshops. We'll have a 60-minute and a 90-minute breakout session. So I could just see the steam in this Zoom room right now. I know there's a lot of great energy and ideas that could be presented, and we would love to have you submit an abstract for a presentation. So keep your eyes peeled. Midweek, next week, we'll be dropping that invite for breakout sessions. It's a very simple application. We wanted to keep it simple so that you can work on it, get your ideas formulated, and submit it to us we'll give you about 2 weeks. And then we plan to evaluate those applications the end of January. So reach out to Julie or myself if you have questions about that. If you're wondering, would this work? And before you spend the time going into the Google form and actually, putting together your draft, feel free to reach out. But we do explain that pretty well, I think, in the instructions that we'll be sending. So you'll get an idea of the shape and form in what we're trying to accomplish through the conference. So just excited to invite you all to come to it and invite you to participate by doing a presentation, by sharing, learning, and networking and supporting it.
And I think, when you receive when you receive the invitation with the follow-up email to this, if you haven't already, hopefully most of you have, the save the date and the registration information, pass it on to, the folks that are members of your coalition, the folks who come to your coalition meetings, your school staff, your colleagues, if you work in a school, the parents on your parent advisory group, right? This is really a conference, a prevention conference, looking at raising that knowledge and awareness around what works in prevention. And we know that, again, lots of new people in the field, people interested in it, right? Getting to know what is around New Hampshire, but also other folks coming in and sharing their knowledge and expertise. So one question that has come up is, the audience for this conference this year is adults who work and support young people. So that's the audience this year, hoping in the future to have a youth track. But this year, the attendees would be adults.
Yeah, and Julie, I would just build on that. One of the the breakout session categories or topics is if you do work with a youth group that would like to share what they're doing with other adults because they want to be able to spread that knowledge and enthusiasm. So they've designed something and they want to deliver it. That is like an idea that we definitely covet, and we would love for you to bring, to offer a workshop like that. We as a planning team don't have the capacity to put together something like that with youth, but if you're working with youth and engaging with them that way, then submit an application for a presentation. We'd love it.
Thanks, Martha, and sorry that the time got cut short.
Yeah, no problem. Thank you for having me.
Any questions for Martha? All right. Okay. Any anyone else want to bring lots of stuff in the chat? We've got Barry Sandberg, Wave Barry, introducing himself for the young adult strategies.
Do I have a moment, Julie?
Yes, please.
Terrific. Hi, everybody. I recognize a lot of friends and colleagues on the call. Happy New Year. Just wanted to speak about our project. It's a population we don't often talk about, and that's the young adult strategies for prevention. Our project is supported by Department of Health and Human Services, and we work with those who are very late teens to mid to late 20s, going through transitions in their life, and that may be around school, work, family, relationships, or whatever. And our project is really three-pronged. We do numbers of trainings and programs which we're developing for the new year. We also have a very robust social media presence, and we're also developing an online resource library. We're statewide. If you know of young adults who are interested in this kind of work or would like to be part of our council members are also paid stipends. So if you'd like more information, please get back to me. And Julie, thank you so much for the opportunity to meet together today.
Thank you. And Barry, if you have a website, is there a website? I saw your email address, but do you have a website that you'd like to link?
I do not have a website at this time. We're working on that.
Yeah, great.
Thank you.
Barbara asked me if we're going to be able to capture all these resources. We are, and we will go. If you did not get it in the chat, email me right after this. If you have a PDF of any of your resources that may not have come through the chat, please email them to me right now, so that we can get these resources out in our follow-up email as soon as we can. TI has a couple of spots in their winter Leaders in Prevention program for middle school students. So look at that. The link is in there. So if you work with middle school students, this is a group of, I should just let Marissa tell you. I don't know if she wants to unmute.
Yes. Yeah. So so we are still open to a couple more teams. It's a really fun weekend of action planning and leadership development and networking for middle school students. We're up at Camp Cody in Freedom, New Hampshire, on beautiful Lake Ospey, and it's a great fit for folks that are working with middle school students either in school or in out of school groups. Great fit for additional leadership opportunities for development for any of the middle school getting to Y folks, right? So I think it can definitely partner with other things that are already happening. And it's a great time, and we have different partial and full scholarships for teams depending on a couple of different factors. So definitely reach out, even if you're not sure kind of what a funding source would be. We might be able to connect you with funding.
Awesome. And one other thing, what other hat are you wearing, Marissa?
Oh yes, I also put things in about the Prevention Certification Board of New Hampshire. We have a lot of different pieces of information kind of going into the new year. Prevention Specialist of the Year nominations will be coming up. If you haven't checked out, if you are a certified person and you haven't checked out the new advanced credential in New Hampshire, there's a lot of information about that on our website. A little bit of a kind of, some new goals to hit for a lot of our really awesome experienced folks in the room. We also have office hours that we started doing in 2024. We're going to continue in 2025 because they were well attended. They start in 1 minute, theoretically. If you have questions about certification, you'll see some familiar faces in that office hour if you happen to pop on over to that. And
the link has recently been put in the chat if you would like to continue to learn about becoming a certified prevention specialist. Hop on over.
You might even get to learn about it from Julie or myself. I've heard.
We may be over on a different Zoom room in 1 minute.
A time.
Yeah.
So so last thing, and we're gonna have a new website kind of rolling out. This information is on our current website, and then the new one is going to be even exponentially more user friendly. So.
All right. Well, thanks all for being here. Again, apologies if I did not get to you. Jess, more input, a lot of great stuff in the chat. It is too long for me to summarize. So many good things coming from tobacco. And so read it. We'll send it in our follow-up after this, but I see some stipends and all that. I don't know. I don't have to go right now unless anyone wants to go talk about prevention specialists. Marissa can start that meeting. But Jess, do you want to just share what that is? I know everyone's probably got to go, but maybe one last little share.
Sure. I'll just,
All right.
I mentioned it during the November partnership meeting, but the tobacco program is offering sponsorships to youth coalitions or regional planning commissions, or realistically, any nonprofit that's doing work on youth tobacco work. So reach out to me at tpcp@dhhs.nh.gov and I will set you up. And if it's not currently, because we have certain pockets of money available now, and then we're going to have another round coming later this year. So we're looking forward to getting the money out to you all and doing the great work that you're already doing and helping support you.
Great. I hope people stayed on to hear that part. Funding opportunities are always the best, right? Well, thank you, everyone. Happy New Year. It was great to see everyone. And we'll be in touch. Don't forget to send your resources. Don't forget to complete the evaluation, and we'll talk to you soon. Next meeting in March.
Hey, Julie.
Yeah.
Where's the eval? There's so much.
I know. There's so much. Emma, can you?
Buy it.
Emma just did it again, and we'll include it in the follow-up.
Okay. Well, awesome.
Yeah, it is the last chat at this moment.
Okay, thank you.
You want to just get it done.
Yes, thank you.
All right. Bye, everyone.
Bye.
Jennifer, it was confusing with the Kate McDonald name.
I don't know why it does that.
I know.
Figure out how to
I've
change
never
it.
seen it do that with you before.
I'm on my phone. I don't know if that makes a difference, but
No,
I
that
still.
is even weirder that it's on your phone and is calling you.
I have no idea. And I was like, I couldn't figure out how to change it for the life of me. I just gave up.
Okay. Jennifer McDonald, thank you.
Yes.
Yes.
Thank you for having me. It was great. So many resources.
So much, right? It's a little overwhelming.
A little bit, but I am definitely getting my toes wet and feeling like, every day I connect another dot. So it's good.
Yeah.
Good.
Yeah. If that DFC coordinator, Monica Gallant, is like amazing. Have you met her before?
I think I was in a meeting with her of DFC coalitions the other day.
Yeah.
Yeah.
She I don't know. If you want me to introduce you to just say brand new at this work, could you guys meet up